Get rid of that. All right. Hey, my medical coding family, how's everybody doing? Happy Monday. Good to see everybody. Let me try to get rid of some of this stuff that's on the screen. Got stuff all over the place. Put that down there. Let's see how that looks for Tiki Talk. Okay, we need to raise it up some. Yeah, that's better. Hey guys, how's it going? Good to see you guys. I got some practice questions if anybody wants to work on any of them. Let me get our chat going. There we go. Today's the 12th of the month already. Oh my goodness. What does this mean without a course? That means that you can do just like I did and become a medical coder without a medical coding course. It is not required. When they say that they have a prerequisite for you, that just means they sell one. The only thing that you need to do to get certified in medical coding is to pass one exam. You'll need a membership to aapc or ahima, depending on which organization you want to get certified in. And then you need to pay for the exam and pass it. I self-studied without a course and became a medical coder, and you can too. I hold certificates in CPC, CPMA, and CPCI instructor. I am licensed through AAPC and I am one of their instructors, but you don't have to buy a course from me. And I like to teach for free, so I'm one of those weirdos who thinks that education and healthcare should be free for all humans. But, I'm weird. If somebody's sick and we have a cure, there you go. Have at it. If somebody's hungry, let's feed them. Yeah, those kind of things. And if you know something, teach something. If they want to learn, heck yeah, have at it. But I'm a weirdo. Okay, we got the 65. Let's see. You guys are correct. Good job. Perfect. What about the next one? We've got an E&M question. Is there a PDF format of the books? Yes, absolutely. Do you have any websites that do or have mock exam tests? Yeah, that's what I've got going on right now. This is Pocket Prep, which is great. You get access to 750 AAPC practice exam questions on Pocket Prep. If you go to my website that's listed right down here on the page, right? You come here. Right here in the middle of my page is this purple link right there. It says Join Pocket Prep, 750 practice questions. If you click on that and you go to the word medical and you click the top link right there that says AAPC CPC, you get access to these questions that I am showing you right now over all 18 areas of the certification exam. You can take your own mock exams. You can build your own mock exams. You can redo your most missed questions. Um, you can build your own exams. You can do timed quizzes. You can do just your weakest subjects, or you can do 4-hour real timed mock exams. With 750 practice questions, you have a ton of options with Pocket Prep. I love them. It's who I use to self-study. The absolute best thing is that the answers tell you what page numbers to find the answers on inside your ICD-10 and CPT book and HIPICS book. I love that. They also have a pass guarantee. I'm not trying to sell you anything. But if you do use the link, they know I sent you, and they're always sending me like little Starbucks cards or something like that. But I the the more importantly is for you to learn how to pass that certification exam. And I bought my own membership for a year. I pay $8 a month, and I have access to all these practice questions. Love it, love it, love it. They taught me more than anything about why the correct answer is what it is and how to use the manuals so that now, no matter what, because I looked up the page numbers and looked at the guidelines on those pages for all these questions for so many years, because they used to start out with only 500 questions. Now they got 750. Now they're working their way up to 1,000. But year over year, I have found that working the questions that I get wrong in reverse order, like going to the page number where they tell me the answer is, that makes me have to hunt, right? And I have to go find the guideline or the parenthetical that's out of place, whatever little weird, quirky thing that I might not have noticed at first, it makes me hunt it down. And then I learn what I did wrong and I don't do it again. So it's awesome. I love it. I love Pocket Prep. They're great. Yeah, they have cases. They got all kinds of stuff in here. Bingo card. The mock exams are all included. So it depends on whatever you want to prepay for Pocket Prep. I just showed off the cost. So you can get it as low as $8 a month, or you can do $40 for 3 months access. Whatever you want to do, it's all there. My website is medicalcodingbyjen.com. It's listed on the little box right there. So if you come to medicalcodingbyjen.com, the purple link right there that says join 750 practice questions is right there in the center, right at her wrist. Just click on that and it'll take you to the correct pocket prep link. And then you hit medical and then you hit AAPC CPC, the top link. And then it'll take you right here. And the cool thing is you can also put this on your cell phone and take it with you and do practice questions in their app. While you're standing in line at the grocery store, right? Or you can do this on a desktop like I am on your desktop computer, which I love it. What do you guys think is the answer? Yeah. And if you use the link that's on my website, you might end up buying me Starbucks, which would be really nice. Oh, this is not 79. Remember that your 79 and 77 codes are for older children. Some of these codes for babies are differentiated between infant and child. The first 30 days of life are only neonatal, and that is only a 68 code. 68 is the only neonatal code on this page. And you can highlight words that you don't understand on Pocket Prep, and it'll give you the definition. These are some of the new features they have on it this year, which is awesome. Isn't that awesome? If you didn't know what respiratory distress syndrome was, it would give you the definition. So I just love it. And then if you hit the show explanation, it'll tell you why every single answer is wrong, why the correct answer is right, and where in your CPT book the correct answer is. For this one, in the 2025 AMA CPT book, the answer will be on page 51. You took medical coding in 2020? Awesome, Chipmunk. That's awesome. Hey, YouTube guys. How are you guys doing? I'm going to give out some YouTube memberships in just a little bit too, so y'all hang out. What do you guys think is the correct answer for this new one? No, you cannot use your 2024 book on the 2026 exam. I'm sorry. You will need to get either updated manuals and then move your notes over. Thank you for the heart me, Felicia. You're number 45. I'm getting ready for my CPC exam. Any tips? Yes. Do your practice questions with these pages. So look at your different answers. If two of your answers are under incision and two of your answers are under excision code numbers, you can tell just by looking at this page what you would look for inside your exam question. Did I just cut into the body or did I remove something from inside the body? Go look at your question. I removed something. I removed a cyst or something, whatever, from the head, right? I removed a lesion, whatever it is. So then I know that my answer will be one of these. Then I can go straight to my page number where those codes are located. And now I've got it down to just 2 codes. Super easy this way. It's faster this way. And you will know that if you have an asterisk beside a code set number, like this one right here for the head prosthetic, that you have a guideline that you need to worry about for those sets of codes because they have a star beside them. If they don't have a star, then there's no guideline you need to worry about. So these pages are extremely helpful. And if you can do your exam questions for the first part of them with looking at these pages first, it'll help you eliminate and get down to usually a 50-50 shot at exam questions before you even get to the code and the descriptor. AAPC is going to give you a ton of excisions. They're going to give you an excision here. They're going to give you an excision code here. They're going to give you an excision code here. And if you don't know to go back a few pages and look at your body part headers first, then you'll be under the wrong excision code. But if you're doing your questions with these pages, then your headers are right here. So, best advice right there, for sure. What did you guys think was the answer for this one? I now have the 2026 books, have a lot of prepping to do. Oh my. Thanks for the follow, Melly. What do you guys think is the answer for this one? You're welcome, Care Bear. Yes, Jessica, if you have the 2024 books, yeah. Unless you want to, buy 2025 or 2026 books, but then just have them re-reamed with just the cover on front of them. But, Staples re-reams books, but you've got to have a 2025 and a 2026 cover on all your books for the proctors for the exam to know that you've got the right set of books on your desk when you take the exam. But absolutely, you got to have a 2025 or a 2026. If you're going to take an ahima's CCS exam, the 2025 books will only be good till April 1st. Then you have to move on to 2026 books. But AAPC lets you use prior year books for current year exams. So our current exam started over January 1st, 2026. That means I can only use for any AAPC certification a 2025 or a 2026 book. Melly, I have pinned TikToks, 3 of them, that are titled, Where Do I Start? The first thing you need is pick out which certification you want to do, either AHIMA or AAPC, which company you want to do, and then which certification you want to do. CRC is risk adjustment. That's only diagnosis codes, and you only need 1 book for, and it does not come with an apprenticeship. And employers are looking for risk adjusters. If you want to be a medical coder, you need 3 manuals, an ICD-10 book, a CPT book, and a HIPICS book. You can do CCS with AHIMA or AAPC CPC with that. With that, you get an apprenticeship for 2 years where you have to be an apprentice for coding. So you got to go do your own research, figure out what you want to be, and then get the official study guide from the company that you decide you want to do the certification for. If it's AAPCs and you want to do risk adjustment and diagnose codes, then go get the AAPC official study guide and those practice questions from AAPC that they sell. And then hopefully Pocket Prep will have some risk adjustment practice questions come out really soon. But if not, do just the AAPC CPC questions that they have here, because they have a ton of diagnose codes ones that'll help out. But all you need is the official study guide and the manuals that you'll use on exam day and some practice questions. You're welcome. So risk adjuster is the easiest. I don't know. I hate diagnose codes. I absolutely hate diagnose codes. With the CPC exam to be a medical coder, there's only 5 ICD-10 diagnose codes on the exam. So the rest of the exam is procedure codes, coding for surgeries, which I like and I find much easier. I can tell, if I did a scope, if I did an open procedure, if I'm doing a procedure anteriorly or posteriorly. I can tell all that because I can see it in my mind's eye. Diagnosing codes in ICD-10, it doesn't have any joints in it. So, like, if you have, it's just not up to date. It's been out for 10 years. We're the last country on the planet to use the lovely book. Everybody else has moved on to ICD-11, which is what current doctors are being trained on because it's current medicine, it's current verbiage. Heck, you can diagnose somebody with joint pain, right? Instead of a radius pain for an arm bone, It's just because one administration was in office and then now they're back in administration and they took us out of the World Health Organization and we're not sharing any information. That's making it to where we don't update our books and we're not coding like the rest of the world is. So doctors are being trained and we have new diagnoses, but we can't diagnose it because we're still in a decade-old medical book. I absolutely hate it, but it is what it is. You can Google an EHR, what the diagnosis code is currently in the ICD-10 book, and you can find a close approximation of what would be a good ICD-10 code for that particular condition, but it's not the correct one, and I'm too much of an auditor for that. But to be the last country on the planet to use a 10-year-old book in our healthcare system is just sad. Sad, sad, sad. Sorry, guys. I get to, that is correct. C is correct. The answer is on page 91. And like I said, you can click on any of these. It'll tell you the definition of like a punch biopsy, what's the simple closure, what is a wound approximation. Yeah, very cool. Love Pocket Prep. Oh, I'm so glad you found this page too. Hesitating for 7 months? Just go for it. I'm too much of an Aries for that. Go for it. And I like AAPCs because one price, you get to take 2 attempts at the same exam. CCS is cool. Or ahima certifications are cool too, but you pay for 1 attempt and it's a pass or fail, and that's it. And then you got to pay for the exam again. With AAPC, you can buy 2 attempts on the same certification exam. That way you can take the first one right away. just go use it as a learning opportunity, right? To figure out what's on the exam so you know how to study for it. And then you can take it your second attempt after you've already taken it once. You'll know how to study and then bone up on what you missed for the first attempt. They break down all 18 areas too and tell you which sections you need to work on that you didn't make at least 70% on so that you can just go study on those practice exams questions. And then you can build inside Pocket Prep these practice exam questions just on the subject matter that you didn't do well in. On this one, if a star is next to an E and M code, what does that mean? It's not A. It's not 51 exempt. That's the circle with the line through it. And if you look at the bottom left page of any page, all the little symbols are on every single left-handed page of your CPT book at the very bottom. The lightning bolt is the FDA approval for C. It's the Harry Potter symbol is FDA approval. We're looking for a star. There you go. Telemedicine. Yeah. Yep. That's the guideline is on page XX2 of your CPT book. What about this one? Now remember, these codes are age-based. So all you have to do is know what age goes with what set of code numbers. You're welcome. I'm so glad this is awesome. I love Pocket Prep. No, you don't have to buy new code books every year. Once you get certified, you never buy the books again. Everything's in an electronic chart in an EHR system, and the codes are updated by your IT tech team, right? No one ever buys the books anymore. You just need them to pass the certification exam. You can get electronic format of the books, or you can get paper books. And they update codes depending on the type of codes. Some codes are updated quarterly. Some are updated biannually, twice a year. And some codes are updated annually. It's up to the medical coder to know where those update dates are and where they're located in each manual. And it's a really good question on the CPC exam. There's 2 different dates to know for the CPC exam. There's an issue date that they're issued, and then there's an effective date of when they go into effect. Knowing that difference is one of the exam questions on the exam. Oh, I'm so good. Come on, whenever you get ready. You got it right. Which one do you think? 15-monther? Thank you for the heart, me. I think that's 71. Yeah. 72. We got 2 diagnosed codes or 1 diagnosed code. Are we billing admit or are we billing subsequent hospital? A is correct. Good job. Our answer is on page 51 of the CPT book, and then pages 740 and 746 of the ICD 10 book. You got a 59 last time? You got a 59 last time because you didn't clear your headers before your descriptors, right? So if you're not going to the very front of the chapter and utilizing these pages to answer the questions first, you're going to get them wrong. So, like with your urology questions, right? You're going to be given a bunch of questions where your exam question is going to be a laparoscopic, right? Answer A is going to be right here, this number. Answer B will be this number. Answer C will be this number. And then answer D will be this number, or a number inside those little dashes. You're not utilizing these pages to answer your questions, to narrow things down first before you run to each CPT code, then you're doing it wrong and you're going to get your answers wrong. So come here first. Look what red header each answer is under. If you notice this one, if you're doing this laparoscopic procedure, you're repairing or doing something to a kidney. If you're doing this one, you're doing it on a ureter. If you go to these codes, you won't know that you're under a ureter. It doesn't say it on that page. It doesn't say it on that page. It doesn't say it on that page either. It might say it on these two pages where these sets of codes are at, because that's the code, the page where this starts over and that red header is there. But then it disappears as you go through the section and you get more pages. So you forget that you're under only this body part. So if B was here, then you're repairing the ureter. You have to be careful because you go through the ureter to fix a lot of things in the body. Just because you go through it doesn't mean you repaired it. So you have to think about that. And then, was your repair on a bladder, or was it a combo code where you actually put in a stent and repaired the urethra and the bladder at the same time? Check your question. You did do bladder and you did do the stent. Then you know, without even rolling to the codes and looking at their own individual descriptors, what the answer was, because you looked at these pages. Also, if your code set has a guideline you need to worry about, then you got an asterisk right here. So if your answer doesn't have any stars, then you don't have a guideline that you have to worry about. And if you needed to find a guideline, you just run to the first code next to the asterisk, and that's where that guideline is written, so you can go read it really quickly, and to get the page numbers. You're not having to look up and down columns and try to find out of code sequencing and all that stuff. If you do narrow it down and you know you did a bladder, two of your codes are under bladder repairs, this one and this one. And you could run to the correct pages where those are located without having to look for them up and down and flipping through pages. This is vital. If you guys aren't utilizing this, then you're going to get a bunch of stuff wrong. What did you guys think is the answer for this one? Yay! That's awesome. Yep. Some people are saying C, some people are saying A. C is correct. Answer 40. CPB, you don't need to have a certification to become a biller. You can get into that job without having the certification, so wouldn't stress too much, but I have to look and see what I've got in my CPB folder here. Let me see. Let me think about what I got. CPB. What do I need to know about that? All right, what are we doing? Yep, they want to know some of the questions that we already did today, like that 51 modifier exempt. Code 20974 is modifier 51 exempt. That's on the CPB. They also want to know if you know what the 0 with the line slash through icon means. Yeah. Oh, if your bypass graphs. Yeah, ilioceliac. That's a cool one too. Let's see. Stone removals, skin removals, emergency room departments. That it does not matter if they're new or established. Doesn't matter. That's easy. Anesthesia. What do they want us to know about anesthesia? For anesthesia, if you don't know what body parts are in the lower abdomen and then what's in the upper abdomen, like where is your spleen? Where is your gallbladder? Or where's the liver? What's considered upper and what's considered lower? They'll catch you on that. Or what's part of the perineum, if you don't know what body parts are inside each area, that's where they can trip you up on. And then if you don't know that a lot of your cardiac procedures are done only on the right side of the body, or they're only done on the left side of the body, and you've gone through and highlighted the ones that are only on the left, like that, so that the green is left but blue is right, that is super helpful during your exam. And then having your one word differences beside each code. So we're doing a removal, we're doing partial, we're moving a vein, we're removing membranes. Just one little line so that you know what's going on in each one. Super helpful. Marking things like if these are all pulmonary, so they're blue. If you move to a different one, like that's not pulmonary, like one of my other ones that we do mitral valve. My transthoracic ones are always green. I have thoracic is always green, so I know to look through my exam question first, see if I'm thoracic, see if I'm pulmonary. That makes a big difference. Just knowing what to look for fast is super important. If you're intra or extra, or if you're extra extra, that's helpful. And if your cardiac procedure was only done on an artery, cool. Or if it was done on a vein, or if it was a combo code. Those things are really helpful to have color coded right away. CPB, you're going to need more billing insurance information too. What codes can go what modifiers can be coded with what. When your procedure is unilateral, then that means you can do the right or the left. But when it's A bilateral code, you don't add the 50 modifier to it because it's automatically a right and a left. Those kind of things are helpful to know. Which modifiers can you put with which E&M codes and when to add them, like the 24, the 25, the 77, 76 are picked on a lot, including your TCs and 26s. Everybody saying A for ER? Perfect. Good job. Here's you one for the abdominal ultrasound. How many body parts do you need to be done for it to be a complete ultrasound and not be a limited ultrasound? 1, 2, 3. Don't forget, if you want access to these practice questions, super inexpensive, just go to my website, Medical Coding by Jen, and right here at her wrist, you can click on that link and then click on the word medical and then click on AAPC CPC. And super easy to get here. And then you just prepay for how many months you want access to it. Like $40 will get you 3 months, and they have a pass guarantee. Love it. And then you can put the app on your phone and you can do practice questions whenever. And they have 4 or 5 mock exams, including all these questions in every exam area that you guys can create your own exam like I've done for today. We're doing E&M and Integumentary. What do you guys think? Thank you for the 15,000 tappy taps. I said B. What's the website? It's for the mock exam. Go to medicalcodingbyjen.com. Right there. Let me put that back up in there. Yep. Medicalcodingbyjen.com. Go there, and right there on her elbow, wrist area, it says 750 practice exam questions. It'll take you straight there. Just click on the word medical, and then the top link is AAPC practice exam questions. And they're right here. They tell you all about the app and the cost. You can even try 30 questions for free right there. Yeah, I wish I could get it to move around. I am streaming this live on YouTube. You guys want to go to medicalcodingbyjen.com on YouTube. It's streaming directly from my device to your device without going through a cell phone to my desktop computer kind of like thing. Yes, good luck, Yari. What do you guys think for this one? Yeah, AAPC. I told them at AAPC, but they offered an instructor level course for another $3,000. If you do come to my website, Medical Coding by Jen, I have a deal going on right now. If you click on the course options right here at the top, let me fix this. I don't know why it's not there. Here we go. Go to medicalcodingbyjen.com. My website looks like this, and you click the third tab over where it's got course options. I sell the AAPC course. It's the full course from AAPC. I have it for $900, and you get me in on that too. So I'm teaching a course right now. Thursday, our class is going to be Intro to ICD-10. I'm going to show you how to use that book and talk to you about chapter 3 of this course because it's 20 chapters. And the first one we did was the business of medicine, how billing and coding is set up. The second one we did Sunday was on anatomy for coding. And then Thursday's class will be about the ICD-10 book and how to use it and look up ICD-10 codes in it. You have to have the training manual that goes with it. That's the book that's right here. It's got the 2026 with it. But with those two things, you could join in, and it's the same course that AAPC has. You just have me, though. Now, if you want the manuals, the exam attempts, the membership, and everything paid for, yeah, that's the $3,500 thing that's right down here. That's a nightmare, but it's expensive. They charge us teachers just everything that they charge you guys. I do have the course syllabus down here that you guys can download if you want to look at it, and a list of the first steps inside the course and the tasks that need to be done. But I do have it where you can buy it piece by piece so that you can just do a little bit here and there and not have to spend $3,000 on something right away. So if you just want the course, you can do that right there. But pocket prep, practice questions. My Amazon list is right there, and Project Resume is great too. That click is right there on her elbow. If you want to use them, this is CPCs. Jacob and Anne are both medical coders and instructors with AAPC, and they do resume write ups and stuff like that. They do the cover letter. They do your LinkedIn profile overhaul. They'll fix your LinkedIn profile. They'll give you a book about Let's Get to Work, and it's all from the CPC medical coder point of view, and they'll redo your resume and cover letter for you. If you use my name, Jen, like Jennifer, 10, you'll get 10% off of their services, and they've got a bunch of stuff going on. So 3 different options, but if you've already passed and you're having trouble, then come in here and see Jacob and get him to help you fix your social media stuff, and the book and the resume help too. So super cool. But that and pocket prep are great. But yep, I is an approved instructor with AAPC, and I do have the curriculum if you guys need it. And I'm just trying to use my teacher discount for you guys. Not much of a discount, but I do get one. Yes. Questions are basically the same subject material, yes. Now, AAPC may rewrite this question. I believe this question is on the exam, and it's rewritten where you do the CPT code descriptor for limited says 1 organ, right? So AAPC's exam question on the certification exam says you did a spleen and a gallbladder. So you have to decide, are you going to bill a complete abdominal ultrasound, or are you going to bill limited when there's 2 organs? It's basically this question, but it's rewritten uniquely, right? but it's the same subject matter. But the one that's on the certification exam is they're giving you 2 organs that they did, and they want you to pick out whether it's limited or a complete. Poquito español. I can say el gato and get up on the table, mesa, and give me your finger, devil, something. But that's it. That's all I know. I can get my kids up on a table and I can talk to them about kitty cats before I poke their finger to do a lead test. That's about all I can do. Answer for this one, it is B. We're going to have our liver, gallbladder, our common bile duct, our pancreas, spleen, kidneys, inferior vena cava, upper abdominal aorta are all included. If you're on page 565 of your AMA CPT book, that's where that answer is located. They actually have it all written out right there. What do you guys think is the answer for this one? Anybody want to answer this one? Hey, Tiff, good to see you. What do you guys think? RAS Education has requested to join as a guest. Very cool. ASMI has requested to join as a guest. Oh my goodness. What in the world? All right. Are we a new patient or an established? We know if we have the 4th digit of a CPT code in the 99,000 range that our difference is whether we're new or established. We can look at the top part of our question, see that we do have a new patient, so we know we can eliminate A right away. Goes out the door. Now, are we a straightforward, low, or a moderate office visit? That's all we have to decide here. What do you guys think? Well, if you look at your manuals, right? How many minutes is a 214? That's 30 minutes. 213 is 20 minutes, and a 212 is 10 minutes. In your exam I believe it said 31 minutes was spent doing that encounter. Is a 212 all you're going to bill for that based off your doctor's time? Thank you, Go Kart, for the reminder. Let's send some money with the credit card to AAPC or to the YouTube, and let's have them give out memberships. Here we go. And we'll have 5 prize winners that will win unlimited access to all of my exclusive material and courses and podcast and book prep videos for one whole month on YouTube. I hope those memberships help out a whole bunch. Looks like Juanita, Emmy, Andrea, Tracy, and Micah all won. One of the first babies I ever delivered was a little girl named Michael. But anytime I see any variation of it, I always think of her. Still to this day. That's 1994. Isn't that crazy? Your medical career goes with you for a long time, but you always remember your first. You just need to be on my YouTube channel watching the live there to be entered in. I just send them money on my credit card, and then YouTube picks a winner out of whoever's in my chat room. And I do this every time I go live on YouTube. I also do have the YouTube membership. It's only $5 a month. So less than one Starbucks card drink gets you access to, like, I drink the small ones. So less than the cost of this little refresher this morning is the price for all my exclusive material on YouTube. And it's been that price for, 3 years now? Never have gone up on it. So hope that helps you out, guys. We got up this morning. We're out the door at 6:30 this morning and fought all the senior citizens showing up at LabCorp at 7 a.m. this morning so James could get his routine blood work. He's had high cholesterol since he was 10 years old. He's 16 this year, so had to get his cholesterol checked. And then Travis went to the DMV. We had an appointment at 8 a.m. and he got his learner's permit this morning. And then we went to Starbucks, and we still made it to school before school started at 9 o'clock this morning. So we did good today. We had a nice, fun morning. The DMV, though, it was crazy. They said that Travis's social security card number came back with my middle name or his middle name. Like, how in the world did that happen? And there's no way it could have, because I even have a passport with his correct name on it. So I don't know. They had to do some clickety clack and fix some stuff, and I don't know what happened there, but they eventually figured it out and got rid of my middle name out of his name. It was just too funny. I have no idea, hun, about the Philippines. I have some bestie friends in the Philippines. Bestie friends. Both of them live in Australia now. And I've known them 20 years now. 2 sisters, and they were neighbors. They're not sisters, they're neighbors. They were born on the same day, and their parents named them the same first name except for one letter difference. It's really cool. And I still follow them and everything on Instagram in their life and watch them go to college and stuff. And got two buddies I want to go see and eventually meet in person. We met in LA at some movie premieres back in when was that? 2011 in person when they were visiting in LA too. But I've never been to their country, and I would love to go to their country and meet them in person. But I don't know. I guess I'd have to send you to my friends in the Philippines and see. Is it okay to use the 2025 books on the 2026 exam? Yes, absolutely, Nicole. Perfect. Hey, Haley, what do you guys think is the answer? Y'all are thinking C, even though the 30 minutes says it was a 04? C it is. I wonder why. I guess because the low decision making, the time isn't applicable. Because if they'd have just left that sentence off, they could have built a 214. Because 30 minutes of an encounter time means that you can build a 214. All right, what does the POS code for 65 stand for? Be sure to know the differences between your POS codes 31, 32, 33, and 34 on your CPC exam. They're all 4 nursing facilities, but they're very different. Some of them are inpatient, some of them are just skilled nursing. Some of them don't have any medical component whatsoever, and you need to know those differences. And some of them are like like just for waiting for them to pass away, where they're just in hospice kind of like thing. So that's one of the questions on the CPC exam is they give you a tricky one and you're not quite sure which one of the POS codes it is because they're all 4 kind of the same nursing facilities. Alyssa, this comes from my website, medicalcodingbyjen.com. I got to do the puzzle. If you'll come here to medicalcodingbyjen.com, come to the main page and just look at her wrist right here. There's a link for join 750 practice questions. Just click that and then click the word medical and then click the top link that says AAPC CPC. That'll get you access to all 18 areas of the CPC exam. And all these questions that I'm doing, I built this exam, and you can do the same thing. You can build, you can do mock exams, you can do just your lowest ones. They do have a pass guarantee and really, 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 really affordable rates. Absolutely fantastic rates. $40 for 750 questions. It's great. Plus, they tell you where the page number is for where the answers are, which is super helpful when you get them wrong. D is this one, and when you hit the explanation, it'll show you and tell you where the answer is, which is super helpful. All right, what about an FNA biopsy? And we're going to also use ultrasound guidance. Would that be 4 CPT codes? Would it be 2? Would it be 4? Or would it be 3? That's what I like to do is count. You know, if I was billing this, what would this equate to, right? Did I do something that was 4 different things to bill for? 2 different things, 4 different things, or 3 different things? I did 3 lesions with ultrasound. Does that mean 4? Hmm. Oh, yeah, cardiology is so fun. Yeah, on my website too, the free resources are great. I have all the social medias there. The FAQs are great. If you go there, the third sentence has all the free resources that I know of that are available. The first two sentences are about Discord, how to create an account, how to log on, and get into our free Discord group where I have all these rooms already set up with different practice questions, different certifications, job resources, even your fur babies. Or if you have something off topic that you're struggling with, like my baby cousin Christopher had brain cancer a year ago, and he's a police officer in Tulsa, Oklahoma, and I shared his struggles, those kind of things you can share in there. Our Discord study group is great. But underneath the free resources, I have a list of free grants, free scholarships, free classes, free anything that I found over the internet that could be very helpful for you guys. It's right there. Also, underneath the free resources, I have CPT book prep and ICD 10 book prep. Just click on the picture, and then I have the instructions completely free. Just click on it, and it'll tell you what to do, and you can make your notes like I make mine. I also have the book prep videos. First three, anyway. You can watch me go code by code and do book prep um, on video. And then if you want to see the rest of all my videos like this, you can get the YouTube membership for $5 if you feel like it. But I get you started right here, and I have all the instructions listed out, which is great for all the books, the ICD 10, the anatomy, all that stuff. It's all here for free. So come hang out, look at my website. There isn't a lot of, trying to sell you a bunch of stuff. I do have the aapc CPC course right now for $900 if you want it. With the training manual, you have to get it too, or have a copy of it. You can get an old copy, borrow one, whatever, but you got to have the training manual to go with it. But the course, the real AAPC CPC course right there, if you want it, is there. So totally up to you. The syllabus and all that stuff is down here where you can download it too. Underneath the free resources, you can go to the free lesson blog. I've got tons of blogs here where I help you guys with anything from job resources and career advice to I have a 9-chapter E&M course that's completely free. You can just read it, and it's 9 chapters on the elements of MDM. You can do those practice questions and stuff for 9 whole chapters. It takes you from what's a new patient to how do you code MDM without anything. You got to code it with problem, data, and risk. That's all there for free. I draw pictures of eyeballs and tell you how to code them, and there's just a ton of free stuff here. These are all just free things that I write up, little lessons for you. You can use those. And then also, if you go to the free practice area, I have practice exam questions and PDFs that you guys can download and do practice questions. Just click on what you think the answer is, and then the rationale comes up instantly for you for every single question, one by one. So I really like doing that. But that's a ton of free practice questions. And here's some E&M flashcards for you guys and some more that you can download for free. So all free. But the main thing, of course, is pocket prep for the practice questions and project resume. And then if you want to know what pens or highlighters or what desk do I use or microphone or camera did I use for the exam, that's all on that Amazon list right there. So it's all organized and ready for you. You registered for the class? Was that I had one today, and I think she already had access to Blackboard, so I was having I was having trouble finding you and adding you to my class because you already have a log on with Blackboard. So I had to tell George at AAPC about you today. And I said, you got to go hunt her down. Um, and find her in Blackboard and assign her to my course, because probably you're assigned to another course somewhere else or something. So I told him to do that today. He should do that by tomorrow. I'm still kind of waiting on, the credit card people to finalize payments and stuff. It isn't all instant, but I figure you're good for it. And I told George to go on and charge me for your course and stuff and go hunt you down and sign you up. So hopefully that will work. But I also needed to know if you needed a textbook for the course, because you got to have one of those. But I don't know if you already got one from another course or something. And I'm assuming you do, since you already have a Blackboard login that he's got to go hunt you down. So I'm excited for you to start. That's going to be great. I already emailed you too. I'm not a fan of your iCloud email addresses. Those things seem to never work with email. So I sent you an email first thing this morning too. So make sure you're keeping up with your emails, because stuff will be rolling in on it too. I already asked or sent a couple of emails to you. Hey, Kanisha. Hey, user. Hey, Vanty. Good to see you. Hey, Diamond. Jim Brat, thank you for the heart me's. My son is so mad at me because I have not gone to the gym with him in like 2 months, 3 months. Oh, he's so mad at me. Alexis, how you doing? Levon, thanks for the follow. Yes, you need to order your book. Okay. All right. How do I change my email? I have no idea. If it's working for you for Blackboard already, because Blackboard's already you already have it signed up with AAPC, then that's okay. If you're already using it on Blackboard, that's fine. I'm just scared of iPhone technology, I guess, probably. But hopefully you got your email from me today. If you didn't get any email from me today, then yeah, we got to figure out something on my website about that. Hey, Key. Hey, Belladonna. Good to see you. Hey, Sam. Can a person from the Bahamas take your class? Absolutely. I've got several Bahama besties for sure, for sure. Absolutely. I know of one right now in my class. And then my absolute favorite bestie from the Bahamas. Where is she at? Miss Edwards, my juicy buddy. On Miss Instagram, she is the juicing queen. She's from there too. I love her. And I taught her from 2020 all the way. Yeah, it's been 5 years. She's been a student of mine. So lots and lots. Here from the Philippines. Hey, Bella. Please keep the IT director happy. That's hard to do. Ooh, he's so mad at me all the time. Hey, Pat. Thanks for the follow. Hey, Love It. Love It says D. Good job, guys. The answer for that one is on page 85 of your CPT book. What about this one? Yes, I have Blackboard. Okay, good. Yes, and you got the email today. Okay, good. Then everything's working all right. Perfect. You can take your time about the textbook if you need to, and I can pre-order it for you. You can purchase it when you can, whatever. I'm happy to help out whatever you need. Because I know you just bought the course. So if you need a little time to buy the textbook, just let me know. Email me or whatever. I never know how everybody's doing, you know. I assume you're all doing as bad as I am. You know, it ain't fun in this economy no more at all. I miss my early 90s, man, when I was working for Tenet Healthcare in Memphis, Tennessee. Oh gosh, who was in office then? It was that Clinton fella. He was crazy. But my health care was $35 a month for the best health insurance, and I had daycare at the hospital. As an employee of the hospital, if my kid was sick that day, but I had a shift at the hospital, you brought your sick kid to the hospital and they just sat in the sick kid hospital wing with all the other employees' sick kids. And they took the payment, which was like $4 an hour back then, out of your next paycheck for the sick thing. Never was that. I felt like such a valued employee, and, you know, they took care of you. They made sure you could come to work, and they cared whether you were there or not. I don't know. And I made enough money for us, and then I also had really great health insurance if I needed it and needed to use it or whatever. It was great. It was a good balance of work and then resources that you got in return. Now it's flipped upside down. I miss those days. Do you recommend ebook for the exam if the internet is working fast on your exam day? So if your testing center or your home internet is glitchy and botchy because you're scrolling through gigabytes of PDFs, you need to be able to have your computer zoom. If it's slow, you're going to struggle just getting to the codes. If your internet is zoom, it could be an advantage way of doing the exam, because if you type in a CPT code, it first brings up the guideline, and then you can click down the search feature and find every time that code is mentioned. You're less likely to miss things than trying to manually move through a paper book and find it with just your eyeballs. The computer is smarter than us, and it can find every time it was mentioned in other places of the book. It could be a wonderful thing to do it with the ebook. You're going to miss out on having any notes. So I recommend 100% practicing a ton of practice questions, not only AAPC's practice exam questions, but Pocket Preps, my own practice questions. You need to do as many as you can and get really good of doing questions without notes and doing it with ebooks. But as long as the internet is zoom, then great. If your internet is running, but it's slow, they're not going to give you back your exam attempt, even if you complain. If it functions, but slowly during your exam attempt at your testing center, no amount of complaining is going to get you back your exam attempt, and you could lose it if their internet is slow but does the job. If that makes any sense. You don't lose connection, but you're sitting there waiting for it to load all the codes, right? So I could see the pluses in it and I can see the negatives in it. So I don't know what to tell you, and I don't want to steer you in the wrong direction. Jen said it was great. Well, it could be. There's a lot of factors that go into it. Everybody saying A? 85. Page 85. ICD-10. We're doing tuberculosis. Are you an A15 or are you an A18? Just looking at the differences between those headers is helpful. Knowing that the zeros and the nines are usually unspecified or NOS or NEC, and that the 7 and the 8 will be like right, left, unilateral, bilateral, I don't know, untreated, or a different form of tuberculosis. They can move from one type to another. Just knowing how the ICD-10 is set up and the way it flows based off the numbers is helpful for that question. Sup, thanks for the follow. Shelby, thanks for the follow. I need to start watching your videos. Yes, please do. Please do. I hope I can help you out, Wendy. I have so many thousands of hours of these free live lessons available for you guys to watch and replay. If you go to my website, right, Medical Coding by Jen, go to the free resources, go to the social media tab. Just click right here for YouTube. I have Pinhurst, Facebook group. I've got LinkedIn, RedNote, Twitch. This is our free Discord study group. I'm right down there. But if you click on the YouTube right there, you can go to shorts. You always know when I'm going to go live next too, because the upcoming stream is right there posted on the, it says follow back. I'm following back, Freda. I'm trying to. It won't let me follow you. You must have your private account. All right. So it always tells you when I'm going to go live next, which is super helpful. If you go to the Shorts tab, there's a ton of little free 10-second questions where you can tap on the video and watch the question and in 10 seconds try to come up with an answer. I've got tons of those. Just tons and tons of those practice exam questions. And then you can tap on the live tab right there. And all of these are all my old repeat live free lessons. They even have in the header what I did. Like this is CRC, this is E&M, this is urology questions, this is cardiovascular questions, female reproductive questions. Just they're all labeled, and there's thousands of hours. You can go to my podcast, listen to me read out the E&M guidelines, the ICD-10 guidelines, whatever. Super cool. You can go to the playlist, look for my book prep videos, look for my duck classes, which are great. These over here on this side are 2 hours each. They have the hardest practice questions that I can find, and we go over those. Then I have the CPT book prep videos. I have the ICD-10 book prep videos. The workshops are great. Those are 75 questions all in one video. And that's all we do without a bunch of gabbing and advertising. It's just 75 questions in one video. You can pause the screen, give yourself 2 minutes, and then release the screen and see if you got the answer right. You can practice a ton of questions that way. Speaking of questions, if you go to the post page, I have an army full of free practice questions. It looks different because I'm on my account, but you guys won't see it lit up with the answer. When you come here, it's not a video, it's just practice exam questions. And then you click on what you think the answer is, and then it'll give you the explanation and the correct answer. And I have hundreds of these. And in fact, I've got some that are so good, like the Moss surgeries and stuff. They're awesome. But there is a ton of stuff right here just on the YouTube channel for free for you guys. And I hope to see you in the next upcoming lives too. There's all the practice questions and, popular videos that'll bring up the past streams. You can even create little top community clips. So if there's something inside my video where I just said something profound that means something to you, you can clip it and create a 5-second, 10-second, 30-minute, whatever you want to do video and post it in our community saying, "Hey, this was really helpful. Did you guys see this?" and post it, and then they'll be right here in our little community clips. So, it's all up to you what you guys make of this, which is really cool. Anyway, back to this one. What do you guys think is the answer? No one cares whether you had training or not. They only care about whether you have a certification or not. And for finding a job, um, I've got Project Resume, right? We've got Alex and Ann, who are CPC people, or Jacob, sorry, and Ann, who are instructors and have worked with AAPC. They actually are on the board of fellows and stuff. So they are in the community working, and they will work on your resume. They'll redo your LinkedIn profile. They'll get you a book about how to get a job in the career. They'll redo your resume and cover letter, and fix your social media and get you set up for that. You can use Gen 10 at checkout and save 10% off too. So great people. You just need to network with your community if you want to find a job. I've been in the healthcare field since 1994 and never have I ever had to hunt for a job. I've done lots of things, from delivering babies to shooting x-rays, drawing blood in labs, to running urgent cares or family practice groups, to being an auditor or administrator. So it's always changing, always evolving, and just having the certification you need to get a foot in the door is all I ever needed. Never needed no degree for anything. Hey, Callie. Hey, Amanda. B. B is correct. The answer is on page 462 of your ICD-10 book. Good job. What about our seventh character in our ICD-10 book? Thank you for the 28,000 taps on TikTok today. If we take the course elsewhere but want access to you, which package do I purchase? Oh, nice. I know you've been working with the state of Arkansas, girl. Get yeah, get Arkansas to get the package for you, your books, your manuals, all that stuff, and then just do the cheapest package I've got on there. I think it's the $9.55, and then I can have George add you to my course, and then you'll get access to everything. You'll be added to my roster and emails and my notes, my live lessons, the recording of my lessons, whatever can be added into that. But get Arkansas to send you all your manuals and stuff, your textbook, pay for your membership, pay for your exam attempts. Oh, heck yeah. You took the boot camp for CPMA. Hey, Karen, how are you doing? Did you pass? Yeah, you get access to me for a whole year. So if I teach my class I usually do it in like, because there's 20 chapters. I do one chapter, a lesson, but we do 2 chapters a week. And then we have some chapters that we do like practice exam questions and mock exams together. So there's some extra weeks in that. But most people give you 10 hours of teacher instruction, and that's it. The rest of the hours are the videos and the work that you do in the course by yourself. And they give you 16 hours, and that's it. You get like whatever I'm doing for a year, you get unlimited whatever. You can have access to all. Like if I taught it 20 weeks ago and I start over the course again with the business of medicine again, and you want to join in on those lessons, join in. It don't matter. You can hang around and redo lessons and start over. Life happens. You get access to me for a year. I finished 1 hour before and finally passed. I am a CPMA because of you. Oh, you're giving me goosebumps, Karen. That is awesome. That is why I created that workshop. Another instructor asked me. She had taken it like 6 times and could not pass the CPMA, so I made her that video. And so that's why it's there. And I am so proud of you. That's awesome. I couldn't have done it, couldn't have led a horse to water without it drinking. So I'm glad it made a difference in your life. That's awesome. I'm so proud. That's great. That CPMA workshop, what's like $28 or something? That's awesome. That is fantastic. And now you're a big dog. You're a CPMA. You get to make people nervous when you walk in the door because you're an auditor. And then the other thing about being an auditor, when you work as an auditor, no one knows what you do for the medical company. So they leave you alone. It's like, I don't know what she's doing, but she's doing something over there. And you can just look angry and busy, but you're really not doing anything. It's kind of funny because the more money you make, the less work you do. Like the minimum wage, front desk, or customer service worker is really working, right? But we're hidden away doing medical chart auditing. We're just treasure hunting. And I find it's not like work, it's just treasure hunting. You're looking for missing material. And it's pretty cool. I love it. I'm so proud of you, Karen. That's awesome. Sherry says D. Perfect. Good job, guys. Karen said, it's totally worth it. Thank you. Thank you. You are very welcome. I'm so happy and ecstatic. I made a difference. That's awesome. I did the AAPC self-paced course, but did not know it was only 7 months. Oh, you thought it was a whole year? Sometimes they price them out weird like that. Like if you get the course when you buy the exam attempt, they sneakily in the terms of agreements only give you access for 6 or 7 months, and then they also only give you one exam attempt. So you really have to read the fine print on all that when you're purchasing stuff and make sure you keep up with it because you won't have anybody telling you, hey, you didn't do anything this month, or you only have 60 days left. Let's do this many chapters, right? So it's just self-guided. And if you don't know that it's fixing to end, no one's going to tell you. It's rough. It really is. I don't know how you did it, but you are amazing. Oh, no. Couldn't have done it without you being amazing too. I ran out of time and didn't get to finish. Aw. My boot camps are on my website. You come to Medical Coding by Jen, and you just go all the way over to the video replay button right there next to the notes and study guides. You'll have all the video boot camp workshop replays. So I have 2 that are CPCs. They're 8-hour boot camps. They're like mini courses. They'll go through each 18 subjects of the CPC exam. What's tricky about like integumentary codes? How do you handle those? And then we do practice questions for that area, and then we'll move on. So those are 8-hour videos. And then I have one just for E&M, and that's 5-hour video on nothing but E&M questions and how to handle all that. And then this is the CRC workshop, which was 100 questions, and it's all CRC workshop. And then the one that Karen was talking about is this one for CPMA workshop. It is the $28 one, and it only shows you basically, right, how to handle those cases at the end. The first 35 questions or so are just multiple choice, laws and regulations. What's a random audit? When can a doctor use a stamp for their signature? Those kind of silly things. And then they give you like 35 charts, and then you got to see if they coded it and billed it correctly. Did they use the correct POS number? Did they use the same physician NPI number that they were supposed to? Is it missing a physician's signature stamp? Did they bill the wrong ultrasound because it was limited was done, but they billed a complete? Those kind of things. And I teach mainly how to handle those cases at the end, because everybody can do the laws and regulation stuff. But if you don't know how to handle those charts and you have no time, you've got to be able to do those multiple question chart ones and where to find what's wrong or what's right super quick. And that's what I go over in that CPMA one. And that's just under the video replay tab. Back to this one, people are saying D. It was B for this one. The answer is on 113. And that is because D only does up to or does one lesion. It only does one lesion. So if you code D, you're only billing for one lesion. When should you use an unspecified code? Sorry, Ashley, I can't keep up with everything. Let me see. Yes, you can still use your 2025 books for AAPC's certification exam for all of 2026. Teresa said she's trying to study for her second attempt. She failed the first attempt. What would be really good for you is, if you haven't seen it yet, go to my website, go to the video replays page, and pick that first workshop, the one for 10/25/25. It's $40. It's 8 hours. I teach you from the medical coding certification exam point of view how to handle questions from every section of the exam. And then we also do practice questions. Many people are raising their scores from their first attempt to the second attempt by 30 points with that one video. Legitimately. So, and if you want more questions, I just switched out the questions and I did it twice last year. It's the same PowerPoint, but I have two of them where I just swapped out the questions and have different questions. I think the one from October has a little bit more E&M questions in it. I took out some of the business of medicine and added in a little bit more E&M, trying to balance it out a little bit better than the first time I took it, but they're both equally very good and have had proven results of people taking their second attempts and raising their scores dramatically. And that's not me boasting about it. That's just other people saying it all the time. It was very sneaky, if you ask me. Yeah, boot camp should work. You're welcome, Megan. I'm on my site, Ashley. It's called medicalcodingbyjen.com. And then what I'm doing with these practice questions, if you're on my website, medicalcodingbyjen.com, the main page has this lady on it, right? If you come to her wrist, it's got this banner that says 750 practice questions. If you click on that, it'll take you to this site. If you click on medical and then click the top link where it says AAPC CPC right above my little hair right here, that'll take you to these practice questions that I'm doing right now. They have questions in all 18 areas of the CPC exam. And you can build your own exams. You can do mock exams. You can do time exams, your weakest subjects. They'll send you encouragement, remind you to drink water. You can download the app or you can do it on your desktop computer. And the price is phenomenal. And they have a price guarantee or a pass guarantee. You can do as little as $8 a month, like I do, or you can just do 4 months at a time, 3 months at a time for $40. Love it. Love these questions because they even have, like, if you get it wrong, when you hit the show explanation, it'll tell you why every single answer is wrong, and then it'll give you the page number right here of where to find the answer. That taught me more about how to use my manuals than anything I've ever done before. All the courses or practice exam questions from AAPC, even the study guide. I learned more from Pocket Prep because it told me where the answer was. And if I got the answer wrong, I would go to the page that they say the answer's on, and I would be forced to scour that page, find the parenthetical or the guideline or some sort of descriptor that told me that those were the wrong answers and that's the right one. So the answer for this one was on G3. Pocket Prep has been instrumental in helping me be able to teach medical coding. So I love it. I'm not just selling it, you know, this is their product. And of course, if you do use my link on my website, Dawn, one of the reps there, might send me a Starbucks card. But I'm not making a fortune or anything off of the linky thing. But I do love him to know that I sent you to him because I do have faith in their product and I love it. And I bought it and I think it's great. And I would love for them to know that I sent you there because I stand by their product. I think it's great. I love it. I want them to expand on it. I asked them to make CPMA questions and CRC, and they're actually thinking about doing it. So I'm excited. I love it. And you talk about trying to find a job. Why don't you go to a Pocket Prep and become a writer for practice questions? I'm sure they're hiring CPCs or CPMAs or CRCs, certified people, because they're going to need people to write questions for them. So there's so many jobs that these medical jobs open up. I mean, legitimately, who writes the manual that you're looking at right now at your house, right? The AMA. If you look at the beginning of this book and who the contributors are, who's on their staff, what's that? What's that? What are all these? We've got CPCs, CCSs, CRCs, all this. These people are all medical coders. Some of them with just a plain CPC. You can get so many jobs. It's just different. There's all kinds of different openings that you can get into. You never know where you're going to end up in the medical field, but you just need to get your toe in the door. You'll find some niche, something that you're good at that you really like doing. Just volunteer for a lot of stuff too. If you're working for a medical group and you hear administration complaining about something that's coming up down the pipe that they don't want to deal with, volunteer for it. That's how I got into auditing too and working for administration. Listening to people complain about something, saying, "Oh, I can figure it out." And then I just Google it and figure it out. Which section of the CPT manual utilizes time? Boot camp for sure was an eye opening for the cases, but the regulations are hard. Yeah, for the regulations, I wrote all those in my manual so that I had them on exam day. And that's all. How much is your course for Thursday? Uh, the full CPC course, if you're looking for it, I have it. If you come to the AAPC or to the Medical Coding by Jen website, go to the courses page. I have one right here that started in January. So my next class is Thursday. It's $955. You get the full CPC course, self-paced. You get access to it for a year. And then you do need a workbook. It's not a study guide, it's a workbook. It's a study guide on steroids, but it's got 20 chapters in it that you need to have along with it. So those two items gets to you Thursday's class with me if you're looking for it. Which one uses units of time? It's anesthesia. You guys know this. That is on page 68. Anesthesia uses 15-minute intervals, time-based measurement for coding it. What about this one? How would a coder select the correct code to bill an excised benign lesion? We know benign is 114, don't we? You've been roaming around with me long enough. As soon as you see the word benign lesion, you should be thinking 114. It should just be going off in your head. 114. Other than that, yeah, they were tricking you. It's a trick question. Yep. You can do hospital coding with a CPC. Do we need more than the practice questions, pocket prep, and watching your boot camps to pass? No. That should do it. Now, I do book prep, right? Um, so learning in my videos and stuff about what's the differences between your CPT codes and what's important to highlight as far as your differences, right? Am I intra? Am I extra? Right? That is important. It's in the front of your CPT book for the instructions on how to use your book. When you go through the book, it's got a list of these instructions for how to use it. And the way they write up the differences between the CPT codes are intras, extras, distal, proximal, medial, infra. And marking those differences between the codes is helpful. So if this was answer A, B, C, and then we had D, I know that the first thing I'm going to look for in my exam question is for any word that starts out with the word I, intra, or extra. If I'm intra, then I know I'm either 79 or 80. My differences between these two, one of them's an insertion and the other one's a removal. All I'm going to go is look for my intra to see if we removed it or if we inserted it. Make it super simple that you can't get any questions right because you've already, or wrong, because you've already got the codes prepped for exam day and you know exactly what to look for in the exam question for your keyword differences. And then you can't get anything wrong. So there's a little bit of book prep go along with it, I think. But if you're using electronic books, ebooks, then you got to come up with another game plan there. Totally forgot about that. Yep. We don't use it that often in CPC about the anesthesia and the time. They use it a bunch for CCS, and it's more on their exam than it is on a CPC exam questions. So we tend to forget that anesthesia is based off time, for sure. How do we calculate? Are we calculate? Oops, I didn't mean to click that. I was meant to highlight something. Sorry, but I was going to say, do we calculate or do we measure something? We got two answers with the word measure and two answers with the word calculating. So think about those two definitions. The answer to this question is on 93. What about a global package? What do you guys think about a global package? Somebody saying D already? Teresa, did you figure out how to get to the 750 questions? Ibid, did you figure out how to get to the course? Thanks, Go Kart. Somebody said A and somebody said D. All of the following are considered part of the global package except. So you're looking for an incorrect answer. Talking to family members is not part of a global package? Hmm. Little latte lady, I love your little picture of your bio thing or whatever on TikTok. That is so cute. Ivana, her little fingers. That is too cute. No, it won't let me get into Pocket Prep. Teresa, it's got to be really super easy. You come here to medicalcodingbyjen.com, right? And then you click on this banner that says 750 practice questions. When you get there, it just says click into medical, and the top link is AAPC CPC. There you go. And you have to purchase it. It's, right here, but it's, $39 for 3 months. But you pre purchase it, or you can get 30 questions for free. But once you purchase it, then you can download it. You have to sign in or create an account, which is in the top um, header. Let's see. There's a very, very tippy top header way over there that says sign in and create a banner. On my website, if you're on my website, you go to the free resources tab, and I do have free practice area right here on my website. And you can do these practice questions by just clicking on them, and it'll tell you what the answer is. Got a whole bunch of them. They're just in little bundles. You can click on one of them, and it'll tell you what the answer is. Just pop up. And this is all free. You can do these for free. I have not opened up personal one-on-one tutoring. It's so hard because time zones, for one. I can schedule it and I think it starts at one time. You think it starts at another time. And then there's technical components about getting Zoom to work, or your Zoom doesn't work, or you're at work or in your car, or it's just kind of a hot mess to schedule and to get completed and done all on a one-on-one kind of situation. And right now, when I'm teaching a new class with new students and the kids just started back, I got three sons and my mom that live home with me. But two of them are in two different sports. They're in different locations and different stuff going on different days. It's really hard to keep everything organized. I'm old. I'll be 55 in April. Yeah. So trying to keep it all straight and knowing where I'm supposed to be at what time when I have schedules changing all the time, it's hard. And I live in a part of Arizona that does not believe in daylight savings time. So when you think it's 2 o'clock and when I think it's 2 o'clock, it's never the same thing. It's just hard. It's just hard to get those scheduled and get it completed on time. Either you're waiting around for me or I'm waiting around, and it's just a lot. I would love to do more of it. It's just trying to find the time and trying to get it to where my website actually tells you the correct time, but it doesn't have the smart enough capabilities to say, okay, this is the time without daylight savings time on or with daylight savings time on in your area. So it's just a hot mess. And every time I open it up, I'll get half of them completed and then half of them I have to reschedule. And then I forget who needs to be rescheduled for what day and what time. And then I get to email them to say, when do you want to reschedule? And then what time they tell me that they want to reschedule it to. I don't know if that's my time, their time. It's, it's a mess. Just trying to hook up with people across the United States is just rough. Or China. I've done tutoring in China and, other time zones and other countries, of course, but oof, it's just a can of worms every time I do it. C is correct. It picks drugs. So the best thing to do is meet me, here on my free live lessons, ask during our live lessons, or join in on my course, join in on our free Discord study group. Go Kart and Twinkle are always in there. They're happy to help you answer questions. It has 5 years worth of information in there. If you want to know what camera to use or if you want to practice questions, there's a ton in Discord too. There's a whole room for it. That's all that's in that room is practice questions. There's a ton of YouTube videos, tons of stuff. I will eventually turn on tutoring again. Probably not till I finish our Disney trip with the cheerleading team. So Travi won nationals, so we're going to Disneyland, and that's in 3 weeks, 4 weeks. So, and we're going to be gone like 5 days. So when I get that done, that's the end of cheer for his season. So I'll have one less thing to be scheduling around. They're going to Phoenix this Thursday. They're leaving, and he's got AIA this weekend. We got to leave Thursday. I'll drive back Saturday, and then I got to teach a class on Sunday. So when Disney's over with, probably March and April is when I'll be able to open up tutoring. It's just too helter skelter right now. If you go to my website at the Medical Coding by Jen and you go to the free FAQ site, let's see, can you guys see that? No, let me switch it to this one. Switch it to this one. Yep. So there's my website. You've got the free resources. If you do the drop down menu at the FAQs, you've got a listing of what is Discord. All the instructions of how to do it, how to set it up, how to get into it is all laid out right there. Even how to create a Discord account and all that stuff. Free resources are right there for free grants and free courses and free anything that I found over the internet that is helpful. But all that's right there. If you go to the social media tab, we've got Pinterest, the Facebook, the Tube of the U, Amazon list of what books or pens do I use, Red Note, Twitch. The Discord study group link is right there. You just click on the join now, and that'll toss you right into the Discord study group, which is right there. And you can join in. And Pocket Prep is right here on my website. All you got to do is go to her wrist right there. The link says the 750 practice questions. Just click that, go to the word medical, and go to AAPC CPC. It's right there, top link. And this is Pocket Prep. You can read all about it. It comes with all 18 areas of the AAPC certification exam. It is practice questions. You get to build your own mock or have timed mock exams. You can build your own exams. You can do the trivia, the quiz of the day, um, anything like that. You can put the app on your phone. You can do it on desktop. It'll keep up with your grades. It's great. It's lovely. They're fantastic practice exam questions. They even have a pass guarantee. So love it. That is Pocket Prep. You just create you an account and purchase how long you want access to it. You can try it out for just 1 month and see if you like it. Or you can do 3 months, which I highly recommend, or a year. I've even done that. My account's for a whole year. The answer to this one was $4.95. It was D. What about this one? Let me switch this up so we can get it better on the Pocket Prep. Tobes, thanks for the follow. Different time zones is difficult. It is. Whew. You're so ready to take the exam. That's awesome. If another intravascular ultrasound is done at the same time as an endovascular repair of the descending thoracic aorta, how do you bill that? What are we doing? Can we not, should we consider or bill? What do we do? A and C are bill one code, where B and D say bill two codes with a modifier. Yep. Should be billed separately. We're going to be on page 273. So we've got our guidelines here in our cardiovascular area about our endovascular repair of our descending aortic, right? Want to know what's included? And when you code something also, open, exposed repairs, right? When you do your fluoroscope, stuff like that being coded, or your intra right there. So very cool, very cool. What do you guys think about this one for our CPT and HIPICs? What does the red dot next to the code represent? That one should have been B. This one, C. The code has been revised. Oh, the code is new, not revised. It is B. All right, last question for tonight. I've already been on for 2 hours. I got to go do some dishes and find some way to feed these boys. They are on their way home now. 6:50. I got one coming in from wrestling and one coming in from cheer. And they had a prep rally today. We've got an excludes 1 or excludes 2. And I got a prep for our class on Thursday. We're going to go over how to use the ICD-10 book. How do you look up a dang ICD-10 code? You got to know the magic word. That's why I like CPT coding, because you don't have to have a magic word. You can look up the body part. You can look up the diagnosis. You can look up the surgery. You can look up anything, and it usually directs you to the right code in multiple areas, unlike the ICD-10 book where you got to know the magic word and the magic index that you got to look up the magic word in, because there's 4 different indexes that you need to look the magic word in. I dislike ICD-10. But we're going to make it good. We're going to make it easy for you. For your 5 little old questions on your CPC exam. They spend 3 chapters on 5 questions on the certification exam in the course. Yes, they will be on the exam, especially questions like this one right here. 100% a question like this will be on the exam. D is correct. Good job. Your answer is on page 4 of your ICD-10 book. I hope this was helpful. I hope you do, guys, look at Pocket Prep. It really is worth it. I sincerely bought it myself. And if they know I sent you, I may end up with another Starbucks card or something. They're really sweet, but it's worth it. I wouldn't send you there to spend your money because I know ain't nobody got no money right now. If it wasn't worth it. I love Pocket Prep practice questions for any of your medical coding certifications exams. This is a great service. You can put it as an app on your phone, or you can only go to the website and do just the desktop. It's great. And then don't forget about Project Resume. If you want to do any, get any help fixing your LinkedIn profile, getting a cover letter and getting your resume redone, and getting a job booklet thing on how to get into the medical coding field, Jacob will help you out, and just use Gen 10 at checkout and you'll save 10% off. So great service. Don't forget, I got a ton of free resources on my website. Don't be afraid of my website. There is free practice questions, free blogs where I'm writing, 9-chapter E&M books completely free for you guys. There's free practice questions. There's free CPT book, ICD-10, and anatomy, book prep photographs, and videos here on my website, totally free. Underneath all these free resources, just click around on all these pages. Super helpful. The Pocket Prep's right here. Project Resumes right here. My Amazon list is right there in the middle. And then if you want to join in on my aapc full course, you need the study guide, or the training manual, and the course are those 2 options right there. We, of course, got full packages if you need the manuals and the exam attempts and the memberships and Practicode. If you need all of that, there's other packages, but hopefully you don't. You can just piece it out a little bit at a time. And I have PayPal, Afterpay, Affirm, and Klarna. So those things are the only options. And then if you just need boot camps, I've got those underneath the video replays. The one for E&M, the one for CPMA, the one for CRC are great. So is the CPC boot camp. Perfect for everything that you need, guys. I hope this has been helpful. Be sure and check out the YouTube page. It has a ton of practice questions underneath the post page that are all multiple choice. They're not videos. You just click on it and see what the rationale is. You can go to the playlist. You can see all of the CPT book prep book videos, the ICD-10 book videos, the workshops. That's 75 questions in 3-hour videos without a lot of fluff or advertising or anything. The advanced classes are excellent. Those are the ones that are 2 hours of super complicated questions. And then a ton of videos. And all you got to do is go to the little hourglass, magnifying glass right there, and type in whatever you want. If you want process of elimination, learn how to do that. Just type in the word process and hit enter, and it'll bring up every single one of my videos that I did process of elimination on. And there are some that are even 2 hours long. This one right here is a video of like 75 questions of just process of elimination. We run through that and do There's 2 of them that are 2 hours long where we do nothing but process of elimination. We're not looking in the book. We're not looking at answers, questions, reading the questions. We're just looking at the available answers and running to the and picking a correct answer and seeing if we can pass. And we, in general, get like a 95%. We might get 1 or 2 wrong, but that's it. The rest will be all correct just by learning the process of elimination. So don't be afraid of the YouTube channel either. Search around, find what you want. There's podcast. Click on the playlist, click on the live tab. The live tab has a list of all the free videos from all my free live lessons, and they're labeled. This is female reproductive classes. This is cardiovascular classes, practice questions. So they're all labeled as what questions we did that day. So super helpful. You can turn my voice off and just fast forward to the questions. Anyway, and then the next time I will be live free will be on 119 at 4:30, same time. And you can hit the notify me and it will notify you when I do go live right there so that your phone will ding and remind you. So you can do that. Anytime I'm going to have another live, it'll be scheduled ahead of time right there. And if you do want access to all my book prep videos and all the workshops and stuff, it's just a $5 a month membership. So that's it. It hasn't changed its price in 3 years, and I appreciate the support for the content. And somebody gave out $10, Miss Andrea, today in the chat in YouTube. And because she did give out $10, then I am going to give away $20 more in memberships just because of her. Because she sent me $10 in YouTube today. So those that are still stucking around, there's 22 of you guys in my YouTube membership or YouTube chat right now. I'm sending out 5 more just because of her. I meant to say thank you, Andrea. I got busy chatting away. Thank you so much for the whatever that was you did. What is that, super chat? She gave me $9.99 today during super chat and thanked me for her membership. So because she did that, I'm giving away $24 of more YouTube memberships. Because she paid for half of them, I'll pay for half of them. So AJ, Sarah, Queen Hoodie, Diva, and Sick One Brand all won memberships to the YouTube channel for 1 whole month because of Andrea. So you guys thank her. Thank you, thank you, thank you. I hope that is helpful for you guys. I really appreciate that. It's so rare to get a super chat. That is really, really, really awesome. Oh, I can't reply to her. But that is cool. That is cool. Thank you, thank you, thank you so much. I really appreciate it. All right, guys. I hope this is helpful, and I will see you guys back on Monday. Well, it's about that time. It is, Tyler. How are you doing? All right, guys. Love you guys. I will see you guys on Monday.